The next patient arrived in a wheelchair. He had had a massive stroke at birth. He was unable to use his left side at all. Cognitively, motor-wise, he was almost totally disabled.
Well, David is 3.5 years old. He is genetically normal, but the chromosome is wrong. David had what's called a vascular accident at birth. He was a product of a traumatic birth. He tore the left middle cerebral artery in his brain. The result is a very large infarction in the left hemisphere. And as a result, he developed severe seizures. We were able to get those under control. But what we're left with is a severe and multiply impaired child. He functions at about a 10 to 15 month range.
The SPECT scan showed almost a total lack of blood going to the left mid-cerebral artery, which of course would involve his right side. But after hyperbaric oxygen, there was a dramatic improvement in the cortical flow, which paralleled the patient's condition. As you can see now, he runs all over the place.
Well, don't you run, Dave.
On the last weekend of January 1999, 9-month-old Kevin developed an ear infection. At first, it seemed like nothing to be worried about.
We had spoken to the doctors over the phone over the course of the weekend, and there wasn't any immediate need to bring him into the hospital, but something wasn't right.
When Kevin's condition worsened, his mother took matters into her own hands.
And it was just mother's intuition. I'll never forget. I mean, Colleen just said, had enough. And she said, I'm taking him in.
Soon after he arrived at the hospital, Kevin lapsed into a coma and was placed on a ventilator. Pediatric specialist Eduardo Hernandez was called in from a nearby hospital. He told the Fickles that Kevin's earache had turned into meningitis, an infection that causes a potentially deadly swelling of the brain's lining. The 9-month-old boy's brain was having the equivalent of a heart attack.
When I spoke to the Fickles for the first time, it was extremely difficult to communicate to them how serious this was. They were in a disbelief that this was happening to them. It was a shock state for them.
I knew he was seriously ill, but I also at the same time felt like he was going to be okay, you know, that they were going to fix it.
But the odds against Kevin were overwhelming. Many cases of infant meningitis end in death. Countless other kids experienced severe brain damage. Doctors put Kevin's odds for survival at less than 10%. Though he was still in a coma, Kevin's condition stabilized. Then Dr. Hernandez made a horrifying discovery. A CAT scan revealed that 5 areas of Kevin's brain were dying from lack of blood flow.
We have a CAT scan that said Kevin was going to be either brain dead or a vegetable for the rest of his life.
Then Dr. Hernandez came up with a daring plan. He believed that Kevin's only chance was a highly experimental treatment called Hyperbaric Oxygen Therapy. HBOT, as it is sometimes called, involves placing the patient in a high oxygen environment under pressure that forces oxygen into every tissue of the body.
We know hyperbaric oxygen therapy is considered experimental, but at this point we had nothing else to offer to Kevin. This was his last chance.
Without a moment to spare, Kevin was rushed into treatment.
He's rolled in on a gurney, and the tank is sealed. And then it's taken down very slowly to 1.5 atmospheres, which is about the equivalent of 16 feet in diving. And the pressure forces the oxygen into all the tissues of the body.
Almost immediately, Lynn says he noticed that his son was responding to the experimental treatment.
You could just see it was like breathing new life into him, this pure oxygen environment, and we'd take him in for an hour a day, and he just got better and better. And it was just something to watch.
Then, on the third day of treatment, something remarkable happened. Kevin opened his eyes for the first time in a week.
I see those big blue eyes. I see those big blue eyes.
It was very exciting. I'm sure when he opened them, he was thinking, where am I and what is going on? What is this tube in my throat?
Hi, Daddy. Hi, Daddy.
He was getting stronger. He was starting to fight the tube in his mouth. It was agitating him. That's a very good sign.
That was the answer to our prayers that we've been waiting for. This is the first step in the recovery, and we knew that this was an important step.
Before long, Kevin was taken off the ventilator that had kept him alive. Amazingly, he was now able to see, hear, and even speak. It was as if a miracle were unfolding before everyone's eyes.
I would not have dreamed, given the early prognosis that we were presented, that Kevin would be where he is today.
Today, Kevin is a curious and active 2-year-old who has made an astounding recovery from an almost certain death sentence. His parents believe they owe it all to his doctor and a daring experimental treatment.
Over the course of this work, covering at least the last 6 years, I've been able to observe more than 100 patients, particularly those with children with neurologic disorders, who've had the combination of SPECT scanning before and after a course of hyperbaric therapy. And there's actually quite a close correlation between the scan results that are seen on the SPECT scans and the clinical results that are observed in these patients. What has been observed is that at times sometimes there's rather striking improvements both on the scans and particularly in the patients, and of course that's what we're really interested in, is clinical results, people getting better. Some of the striking results that have been observed is that, for instance, in some children who had near drowning episodes, they've had rather significant improvements, sometimes to the point of returning to normal function. An intrinsic part of this work has been the fact that in doing scans on patients before and after a course of therapy, each person thereby serves as a control, namely the reference point for any course of therapy in them. And in this way, the SPECT scanning has resulted in being an objective mechanism to document the results of the therapy in these patients.